Hi everyone. We've been talking about diabetes insipidus, diabetes mellitus. We are now narrowing it down to diabetes mellitus. We've gone through the different types, but today I want to talk about the main organ, the pancreas. And you can ask, what is the trouble with my pancreas? Let's go. Pancreatic lesions could be cystic fibrosis. There's another video on cystic fibrosis that I've sent out there. Please look for it. The people who are already diagnosed with cystic fibrosis know that they are at risk of possible diabetes because the endocrine gland and the function of the pancreas is impaired because there are a lot of thick mucus that have been secreted, blocking all the tubes everywhere. So the insulin production is impaired in them, and most of them will come down with type 1 diabetes mellitus because insulin production is shut down, the pancreas is suffering. So once again, my heart goes out to everyone that is sick, but those who have cystic fibrosis, they didn't plan for it. They just inherited it by chance. And now the pancreas is suffering. I'm wishing them well. CA of the pancreas, that is cancer of the pancreas. Insulin production will be impaired because when there is cancer, things are in disarray, things are not in order, including production of insulin. Chronic pancreatitis. This could be as a result of viral infection, particularly cytomegalovirus or Rubella. So continuous heating by the virus could destroy the pancreas. And when that happens, insulin production is shut down and there is hyperglycemia. Autoimmune. Most of the time, our defense mechanisms in the body should fight germs, but sometimes they misbehave. They look at healthy tissues, they look at ourselves and perceive us to be the enemy. So autoimmune affecting the pancreas will lead to shutdown of insulin and increased glucose. Hereditary pancreatitis. Like I said, in the case of cystic fibrosis, that they inherited it unknowingly. So I am sympathetic with everybody, but then the case of hereditary conditions is more concerning because they didn't even plan for it, not because of what they eat, not because of what they drink, not because of their lifestyle. It's the way it is. So is leading to diabetes mellitus and cancer of the pancreas because in hereditary pancreatitis, inflammation is continuous, eating and hitting the pancreas all the time in a chronic way, long-term inflammation because they inherited it from their parents. So they come down with type 1 diabetes mellitus and they will eventually come down with cancer of the pancreas. 2 bullets. Wow. Surgery. Surgery involving the pancreas, maybe because of pancreatic carcinoma or anything like that, and part of the pancreas is removed, of course, the function is reduced, including production of insulin and eventual diabetes mellitus. Hemochromatosis. Iron is deposited in tissues like liver, including the pancreas. They have bronze color and they have diabetes mellitus. So your doctor will check your iron level, particularly if you have reasons to have excessive iron in the circulatory system, like those who have hemoglobin issues like sickle cell, thalassemia, and the rest of them. Increased triglycerides. We told you before, high lipid is not good for your body, particularly one type of lipid called triglycerides. When it is high, it will cause pancreatitis. And pancreatitis on its own can cause increased triglycerides because there will be impaired metabolism of lipids. And when pancreatitis causes impaired metabolism of lipids, we'll have high level of triglycerides, then we have pancreatitis. So they both work, to help each other, but dangerous to the person who is carrying both of them. In other words, high triglyceride will cause pancreatitis. Pancreatitis on its own can cause high triglycerides. So it's a kind of symbiotic relationship, dangerous symbiotic relationship here. Chromosomal anomalies and genetic syndromes. 1. Down syndrome. Down syndrome will come down with pancreatitis. Most Down syndrome people will have what we call Hashimoto's, thyroiditis, and Graves' disease. And in medicine, when you have an autoimmune condition, think of the rest autoimmune conditions. So when someone is having autoimmune condition like Hashimoto's, thyroiditis, it's possible the individual could come down with the rest of them. So, like I've said, in type 1, that is associated with HLA, DR3, and DR4. So, it is possible here. Klinefelter syndrome. They usually have increase in weight and inflammation of the pancreas. When somebody is having increase in weight, you need to know what is happening to the lipid, low density lipoprotein, high density lipoprotein, triglycerides, and I've just said it, that when there's high triglycerides, you have pancreatitis. And when you have pancreatitis, you have high triglyceride. So increased triglycerides in them, particularly Klinefelter syndrome, because they usually have that, then there's trouble around pancreas. Porphyria. Porphyria is associated with pancreatitis. I will make a separate presentation on porphyria in the nearest future. Turner syndrome. Turner syndrome usually have mucinous cystic neoplasms, and this will hamper the function of the pancreas. Okay, pancreas, like I said, is the most important organ as far as diabetes mellitus is concerned. So destruction of it leads to type 1. In type 2, though the impression is that the pancreas is fine, the problem is peripheral resistance, to the function of the pancreas and so on and so forth. But some medications that we use to correct hyperglycemia in type 2 will actually require functioning pancreas, and we'll call them insulin secretagogues. An example of the broad family is sulfonylureas. So either in type 1 or in type 2, the pancreas is still the organ of concern here. So in type 2, we'll give some medications that will still name a functioning pancreas, like all sulfonylureas, like the micron, and the rest of them to correct type 2. Whereas in type 1 is full distortion of the pancreas that will lead to type 1. So either type 1 or type 2, pancreas is subject of reference. So thank you for watching my videos. There will be more videos. We're just going from one step to the other. Very soon we will get to how to make diagnosis of diabetes mellitus, the symptoms, the treatment, possible complications, and prognosis. Thank you.